It's been 5 years since the COVID pandemic began. In that time, trust in public health, medicine, science, and vaccines has declined a lot. That's what we're talking about in this episode. I'm Richard Davies. We hear from two hosts of a new podcast called Why Should I Trust You? Brinda Adhikari and Tom Johnson.
With social media, with there being so many different opportunities for finding facts and finding information, I think authority itself was very difficult to sort of trust already because Americans were kind of primed to mistrust authority going into the pandemic.
People were accusing public health officials of not caring about kids, not caring about, people's existence and survival. And at the same time, there was a lot of people, everyday people, who felt like public health didn't want to hear from them.
Our show is about fixes.
Yeah, how to make the world a better place.
How do we fix it?
How do we fix it?
Robert F. Kennedy may be the most powerful voice in U.S. public health today. As we release this show, he's set to become President Trump's Health and Human Services Secretary. Senate hearings over his nomination have been highly contentious. To critics, he's a destructive vaccine skeptic and a spreader of conspiracy theories. Many Trump supporters see Kennedy as a hero and a fighter willing to take on a broken healthcare system. We speak with two journalists who are the hosts of Why Should I Trust You, a podcast that looks at the breakdown in trust for science and public health. Tom Johnson is an award-winning producer with experience in documentary series, digital, cable, and network news. Brinda Adhikari is the former executive producer of The Problem with John Stewart. Brinda Adhikari and Tom Johnson, welcome to How Do We Fix It?
Thank you.
Thank you. Thank you for having us.
Your podcast is called Why Should I Trust You? Why did you make it?
Yeah, I think it's the central question that so many people are asking of each other today, which is why should they trust institutions? Why should they trust authority? Why should they trust each other in some ways? And I think that's why we named it that.
Yeah, I think a lot of people feel burnt out, fed up, knocked down, let down by institutions, by American life, by the economy, by big business, big banks. And we're sort of in this era of nothing can be taken for granted anymore. You have to earn their trust now. And a lot of folks are asking that question, why should I trust you? And when it comes to public health, they're not immune to this.
And in the case of public health, which is a very large part of the focus of your podcast, the lack of trust could have fatal consequences.
We talk about how America can limp along being as polarized, as divided as it is. Congress can limp along, the government can limp along, basically not do anything. But when it comes to public health, having this level of divide, of this breakdown in trust, it creates a vulnerability for everybody because in order to resist the invasion of a virus, public health tells us that we need super high numbers of people getting vaccinated. Otherwise, that virus is going to find a way in. So not trusting the advice, not taking a vaccine, we are told by public health, has deadly consequences.
I was really struck by the contrast between the high level of distrust among many people over the rapid development of new vaccines against COVID and what happened back in the 1950s after the polio vaccine was introduced. Then there was a huge degree of acceptance. Some thought the vaccine was almost a gift from God. The polio vaccine reduced fear and increased trust of doctors and public health officials, very different from what's going on now. You covered this in episode 3 of your podcast when you interviewed Dr. Paul Offit, an expert on vaccines. What did you learn from him and other doctors about the difference between the response to COVID and to polio?
Polio was a feared illness. It was visible. It paralyzed people. There were these iron lungs. There were these very visible manifestations of it. The vaccine came about, 10 years following the end of World War II, where there was already this sort of national feeling of unity around the Allied troops at that point, that polio kind of snuck in under that as well in terms of the vaccine. And like Paul Offit said, parents feared polio. One of the things I often wonder is that if COVID affected children in a really big way, how would people respond to the vaccine? I think a number of things happened during COVID. It impacted people in waves. It impacted urban areas more than rural areas at certain points of the virus. It impacted blue areas initially and then red areas at a later point.
Blue areas because the first really big impacts were in large cities.
Correct.
Whereas a lot of people living in rural parts of America, at least at first, thought, wait a minute, this is a big city problem. This doesn't really affect us in anything like the same degree as, say, New York or Washington, D.C.
I think that's right. That changed later. And in the initial wave, New York, Boston, like the Northeast, as well as Los Angeles, really saw a huge impact.
And media have changed. In the late 1940s and early 50s, during the polio epidemic, people got their news from TV, from the radio, and newspapers. All of them had editors, whereas online media sources today are instant, unfiltered, and often emotional and reactive.
With social media, with there being so many different opportunities for finding facts and finding information, I think authority itself was very difficult to sort of trust already because Americans were kind of primed to mistrust authority going into the pandemic.
Do we have polling that shows people have a greater distrust for vaccines now than they did before the COVID epidemic?
Oh, for sure. I know that at this point, it's 1 in 3 Americans, or close to 1 in 3 Americans, think that the vaccine did more harm than good.
Wow.
That's right. And I think what a lot of researchers and doctors and folks in public health are tracking very closely is this move to loosen up the restrictions state by state that require a family, if they're enrolling their child in the public school system, to get a battery of these vaccines, standard vaccines, the MMR, vaccines included. And you're starting to see a loosening of that restriction. Families are requesting to opt out of those restrictions. And that is troubling to researchers. That's troubling to public health, again, because it's creating an opening for these viruses in communities where, we haven't seen these viruses for decades.
Part of what your podcast is doing is speaking not only to public health officials, but also to people who have a deep skepticism of public health officials, the vaccine, and don't really trust science. One example is a former TV producer, Melinda Hicks, who lives in Atlanta. Tell me about her.
Brinda was just texting with her 10 minutes ago, I think.
Yeah,
Right, Brinda?
she and I text a lot. So Melinda is really interesting. She was a lifelong Democrat for the last 30 some years, has voted for Democrats for president. And in this past election, she voted for Donald Trump. And she says it was because of Robert F. Kennedy and her views on health, her feelings of frustration with the mainstream establishment when it comes to medicine and science. She was somebody who always, I think, had curiosity for alternative remedies, but There were several things I think that happened during COVID and just in her own personal life as far as experiences with doctors, experiences with authority when it came to science and medicine that led her down this different path.
Let's hear a short soundbite from Melinda.
I want this country, I want our children, I want myself and my family to be healthier.
Yeah.
And I feel like it's been an uphill battle. I feel like I've been, turning products over and looking at ingredients. And, I feel sometimes like I'm working, like our government agencies are working against us. They're allowing things in our food, in our air, in our water, in our soils that are making us unhealthy. And we have to fight against it by knowing these things. And a lot of people don't know these things. And that makes me really sad because we have so much ill health. And I don't think we're supposed to be going through life sick.
Right.
I just don't.
Melinda Hicks in Atlanta, Georgia, speaking on the podcast, Why Should I Trust You? This is How Do We Fix It? I'm Richard Davies. We're making podcasts about the people, projects, and ideas of Braver Angels, America's largest volunteer-led cross-partisan movement that's working to bring people together across rigid lines of partisan divides. Braver Angels' Truth and Trust Project was featured on an earlier episode of How Do We Fix It? Their work aims to bridge divides among people with different views on pandemic public health policies, including those implemented for COVID. Braver Angels helped Brinda and Tom with several interviews on their podcast. In our interview, I asked Tom about their decision to include the views of Melinda and others who sharply disagree with what they hear from medical doctors and public health officials.
We feel it's very important, and for this podcast to be successful, that we bring all sides together and we hear everyone's point of view and everyone's personal story. It struck us when we were doing research that these different sides, and there's a multifaceted, there's many sides to these issues, they just simply weren't talking to each other. And there was a lot of talk of retribution in the air. People were accusing public health officials of not caring about kids, not caring about, people's existence and survival. And at the same time, there was a lot of people, everyday people, who felt like public health didn't want to hear from them, that, they would just do what they were told to do, and liberty would be tossed out the window. So we said, we've got to hear from all these different sides. We're going to hear from public health people. We're going to hear from people who have lost trust.
You spoke to skeptics, and you also spoke to experts. One of them was Paul Offit, who you mentioned earlier. Tell us more about him.
So Dr. Paul Offit is a world-renowned vaccine specialist. He's an infectious disease pediatrician. He sits on the vaccines advisory committee for the FDA. What's interesting to me about Paul is that he's gone against the status quo. He's fearless, in my view. And that's one of the reasons we wanted to have him on, but specifically because we wanted to talk to him about vaccine hesitancy. We wanted to talk to him about RFK Jr. We are in this moment where these topics are very much front and center. And so Paul felt like the right person to call.
Dr. Offit is sympathetic with people who are skeptical and sees that there is a real problem in how what doctors see as truths about vaccines are communicated to the public. But boy, on your podcast, he certainly took the gloves off in describing Robert F. Kennedy Jr., at the time of this recording, the nominee for health secretary in the new Trump administration. Here's a bit of what Dr. Paul Offit said.
I have no faith that there is any way that anyone would be able to work with Robert F. Kennedy Jr. He has, for the last 20 years, with Associated creating his Children's Health Defense Group, is an anti-vaccine zealot. He's a believer. This means something to him. He has said recently, no vaccine is safe and effective. He says when he meets somebody on a hiking trail who's carrying a child, he will go up to that parent and say, don't vaccinate your child, and feel that he has saved them. He doesn't believe HIV is the cause of AIDS. He says the polio vaccine has killed far more people, many more people than it saved.
Paul Offit was not only deeply critical of RFK Jr., but also understanding of one of the people you had on your podcast. This is Daniel King, who is an Army veteran who says his health is now devastated, and he thinks it may have been because of the COVID vaccine, right?
Correct. He doesn't know, but he, in his mind, draws a straight line from the day that he got a vaccine to the fallout of his health, the collapse of his health.
I remember the time. That day, that time, my life changed forever. Like, I don't think it'll ever be the same again. Yeah, we had just gotten done doing a like a training exercise, and I was up for probably 12 hours before I got the booster. Okay, like I knew it was coming. It was just a matter of time. I went over, I got it. I was in the back of my unit for more than a couple minutes, and all of a sudden I got severe side pain, like right at the bottom of my rib cage. It started hurting like crazy. And I'm like, what in the world's going on? But I chalked it up to muscle fatigue. Like I said, we had just done extensive training, and we got released for the day. And I was so sick. Like I had a headache. Like it was like nobody's business. Like it was so bad. I don't think I really started to worry about anything until I started having stroke-like symptoms. That's when I started freaking out. And that was about 2.5 weeks after the vaccination. I couldn't move my left arm. I couldn't move my left leg. And like my left side of my face was all droopy. I couldn't necessarily form a sentence. So they did a CAT scan, and they were basically rolling out a stroke because they were 100% sure I'm having a stroke. They were like, well, did anything happen? And all I told them was like, well, yeah, I got the vaccine like 2.5 weeks ago. But then it was probably about 2 hours later, they discharged me because they said, we don't see anything life-threatening at this point. About a week after that is where my trust for doctors crashed, because I went to the emergency room again by the guidance of my primary care, and he recommended I go to a bigger hospital. And at that point, I had done a little bit of research, but not an extensive amount. And I rolled some things out, and they just pretty much laughed at me, and they said, no, this is what we call conversion disorder.
Daniel King from an interview with Why Should I Trust You?
He really just wants to get to the bottom of it, and he feels let down by the medical community, by the public health community. He feels like he's just being passed along from doctor to doctor, and no one is really taking him seriously and really believing that he has a physical ailment, that it perhaps is something in his head. We played that interview for Dr. Offit, and Dr. Offit felt, sickened by, this story where somebody feels let down to the point where that individual now has lost trust, at least for now, in modern science.
Daniel King went into the COVID pandemic. In fact, he had a COVID vaccine. He made sure his kids had the COVID vaccine. And then as a result of his health taking a very sudden turn for the worst after receiving the vaccine, turned 180 degrees in terms of his now opposition to vaccines and his deep skepticism, right?
Yes. He qualifies it by saying, I may change, but as of now, this is how I feel. And I think what's interesting to me about that is so often we view these conversations in a political binary. Well, one side feels this way and another side feels that way. But when you hear the story of Daniel, you see somebody who served his country, a devoted father, a devoted husband, and he just wants help. He just wants answers, and he's willing to be moved to go back to trusting if he can just get that help. And I found that to be such an important story to highlight so that we don't just get caught in this left right debate about things. And really, it's about we all want to live, we all want to thrive, we all want to be healthy. And so, how can we help each other do that?
Braver Angels has helped us, and it's also helped you with your podcast, putting you in touch with people who are skeptical of public health science so that you can include a wide range of views.
Yeah. So our relationship with Braver Angels is wonderful, but we have been consulting with them and been friendly with Braver Angels now for several months. Francis Collins, the former director of the NIH, had been partnering with Braver Angels to attend these conversations where he also was confronted by feelings of concern and confusion during the pandemic. When we had contacted Francis Collins about potentially just being a part of our show, he was the one who said, you should talk to Braver Angels. So we reached out to Braver Angels, and this wonderful relationship has begun. And we're so grateful to them for this.
I should mention that Francis Collins, Dr. Collins, is involved in something called the Truth and Trust Project, which is one of the initiatives of Braver Angels. And we recorded a podcast with Francis Collins and Wilk Wilkinson about their work together. One being a skeptic of the COVID vaccines and how they were rolled out, and the other one being very much involved in government policy during the height of the pandemic.
Yeah, that's fantastic. We also just have such respect for Braver Angels. And as we were sort of reaching for ideas for this podcast, they sort of led the way and showed a way in which you can convene conversations with respect, with empathy. You can find common ground between different sides of people who come out on, different ends of an issue. And there's a lot of common ground. Sort of gets tossed out the window in these kind of partisan political fights that occupy so much of our headspace today.
Speaking of distrust, the three of us, Brinda, Tom, and I, we're all journalists. We all have a background in mainstream media. So why should anybody listening to this trust what we're saying?
That's so true.
Precisely.
But I do think that what you're really onto something in speaking with people who may have a diametrically opposed view of public health, but nevertheless, can have some respect for one another.
Yeah, I don't know if we're changing minds or opening minds. I mean, we are getting some feedback where people say, like, I hadn't thought about it that way. I'm going to go read that book now. We are upsetting all different, sides of the spectrum, which maybe is a sign that we're doing something right. But we're determined to keep doing what we're doing and keep convening these conversations about these really, really important life and death issues.
Tom Johnson and Brinda Adhikari, thanks very much for joining us on How Do We Fix It?
It's a pleasure.
Their show is called Why Should I Trust You? Ours is How Do We Fix It? I'm Richard Davies. Our sound designer and producer is the always excellent Miranda Schaefer. More details about this episode, as always, on our show page, howdowefixit.me. Thanks for listening.
This podcast is part of the Democracy Group,